We were really excited when our room service research was accepted for publication. We were particularly excited that it was accepted by the Academy Journal for Nutrition and Dietetics because it's a well-respected journal for nutrition and dietetics research, and it's widely read by dietitians across the United States and also around the world. We were also excited that our research was published because it helps demonstrate the positive outcomes of room service, and it also adds to the literature which can assist informed dietitians and key stakeholders in hospitals around evidence-based food service models. Our study showed that the nutritional intake of patients increased with the room service model as compared to the traditional food service model, and it increased in energy by 21% and protein by 27%. We found that both protein and energy increased with the room service model, both in terms of total energy and protein, but also as a percent of patients' daily estimated requirements. Patients' energy intake increased by 21%, which resulted in, on average, them meeting 75% of their estimated daily requirements, up from 63% prior to the room service model. Patients' protein intake increased by 27%, which resulted in them meeting, on average, 85% of their estimated daily requirements, up from 65% prior to room service. Total plate waste decreased by 17%, and what we found was when patients are able to order what they feel like and when they feel like it, they eat more and they waste less. Room service is a very patient-centric model, and as such we were really thrilled that our Press-Ganey scores increased accordingly. When measured against our peer hospitals, we found that overall satisfaction increased from the 68th percentile up to the 86th percentile. Quality of the food increased from the 64th percentile to the 95th percentile, and flavour of food increased from the 60th percentile up to the 99th percentile. And our daily feedback also shows that our patients are very happy with the room service model. Patient satisfaction and nutritional intake are very important to us, but we're also committed to demonstrating that we can achieve these without increasing costs. Our study found that patient meal costs overall decreased by 15%. Mater Group comprises 7 hospitals, health centres, a world-class medical research institute and a nationally accredited education centre, all with one aim, to provide exceptional care. And our commitment to innovation drives us as a leader in healthcare, education and research. Malnutrition is a well-recognised issue in the acute care setting, leading to negative hospital outcomes, including increased length of stay, increased complications and increased costs. Clinical dietitians often struggle to maximise patients' nutritional intake in hospital, and we now know that poor nutritional intake is an independent risk factor for poor hospital outcomes. Maximising nutritional intake, therefore, is a priority for us, and increasingly attention is being turned to food service models that can help us do this. While the focus on room service has often been around patient satisfaction, decreasing food waste and costs, we really wanted to demonstrate the increased nutritional intake associated with this model. So we could not get our board or our executive to continue invest in the room service model if we could not prove all of these benefits. We did a retrospective analysis of our quality assurance data using our partner universities' dietetics students to assist us to collect the data, and we had a comprehensive research team who analysed and wrote up the data. We selected CBORD after careful consideration of our specific requirements as well as the system's capabilities. It was also really important for us to be able to collaborate with CBORD in terms of utilising the technology to its maximum capabilities, as well as working towards new capabilities and functionality of the system to help meet our ongoing needs at the Mater. Having strong data is really important for us to make accurate and real-time decisions. It's also important for us to be able to justify our decisions and to prove value in a very cost containment environment that healthcare is increasingly becoming. I hope that we can encourage more dietitians and food service managers and staff to do outcome measures and analyse their data in terms of changing their food service models. Ultimately, we believe that nutrition is medicine and a significant part of patients' clinical treatment, having significant impact on their clinical outcomes. You don't always have to do a research study and be published as we did. You can design systems and processes that utilise technology that can assist you collect outcome data that can demonstrate the improvements and benefits of changes to food service models, particularly around the areas of nutritional intake, plate waste, patient satisfaction and food costs. Because we've comprehensively collected and analysed our outcome data associated with room service, we can now see the positive impact it's had here at the Mater. We've been committed to employing technology to provide us with data around patient safety, clinical outcomes, efficiencies and patient satisfaction. Once we have good data, we can continually make improvements to our operations. At Mater, we're excited to continue to implement innovative models and processes, utilising advanced technology to improve our efficiencies, patient satisfaction and most importantly, clinical care.